Well, if you missed the program yesterday, you missed ways to help your child get the help he or she needs if they suffer from any type of learning disability. The folks at Brain Balance say they integrate sensory motor activities with effective educational and behavioral methods to help kids with any type of learning disability. And the founder of Brain Balance, Dr. Robert Melillo, is in town for a book signing, and he joins us this morning to explain what makes the center so different from others. I know you're from New York, Doctor. I appreciate your visit here on Central Valley today. Thanks for being here.
Thank you for having me.
So when did you decide that you needed to open up a center like the Brain Balance?
Well, it all started really 15 years ago with part of my clinical practice. I was in practice for 25 years as a clinician, but I also was involved in brain research and academics, neuroscience, neuropsychology, but also I was a parent of a son with some attentional issues. So it was a personal thing as well. And it really all started with me, and Brain Balance all started from a question as to what's actually happening in the brain of a child with ADHD or with autism or with dyslexia, and what can we do about it.
You've written 2 books. Is that what they're about? One of them is titled Disconnected Kids, and there it is right there on your screen. What can people get out of this book?
Disconnected Kids really explains to parents, I think for the first time, really what's happening in their child's brain. It gives them an idea of really what these problems are and why they present with specific types of learning disabilities. Some children have learning disabilities where it affects their academics in school. Other children have problems learning socially or emotionally or non-verbally, and that has to do with the balance between the right and the left side of the brain. So it really explains what the problem is and gives them tools to actually be able to change it.
And it gives us a little insight into what you do at the Brain Balance there. You try to balance the brain, basically.
Yes.
And if we look at some pictures, it seems as though you help them with their physical movements, and explain to us what we're looking at right now.
Yeah, well, what we see is that the brain controls everything. So the brain controls motor activity, balance, sensory processing, vision, hearing. It controls your muscle tone. It also controls your, obviously, cognitive skills, so what we look at is academics, how you're able to read, whether you word read or comprehend, and different parts of the brain control different aspects of it. So the left side of the brain controls more fine motor skills, the right side controls more of the spatial, gross motor skills that you see here with this little girl doing that ball type movement. But we also see she's wearing specialized glasses. She has things on her skin, stimulating her skin on one side or the other. She'll be listening to specialized music in one ear or the other. And the idea is to actually get the whole brain to work together in synchrony so that the child can use the whole brain and bring that into the learning process, because most of these children can't do that.
And how long do you think that takes? Or is each child different? Each
child is different, each child is unique, and that's why we, in our assessment, it takes 2 to 3 days, and we actually literally measure over 1,100 functions on each child. And we sit down with the parent and explain that all to them. And in the book, I go through how the parents can do a much less version of that, but how they can really assess their own child. And then from there, we usually tell the parent that the imbalance either is in the mild, moderate, or severe range, which is somewhere between 3 months, 6 months, or 9 months of our program.
And how do you know, if you are a parent, that your child has some sort of problem? I mean, a lot of kids are hyperactive sometimes, especially after you give them sugar.
Right, sure.
But how can you tell there's a problem, he or she needs to be seen?
Well, there's a couple of different ways. One of the early clues is, did your child hit all the milestones? Did they roll over to both sides equally? Did they crawl exactly the way they were supposed to for a period of time? Did they walk on time? If they missed any of those milestones, they probably developed an imbalance in their brain during that period. And see, the whole thing is that there isn't any injury or damage to the brain in these children. They just have a balance problem because one side developed faster than the other. So it's a developmental delay. And we can correct that in most cases, or certainly improve it. So if there was something that through their motor milestones, if the child has significant imbalances where certain skills are much better than others, that's a clue. And also, if we have professionals, most teachers are pretty adept at coming up to parents and saying, hey, I think your child, may have an attentional issue or may be hyperactive or impulsive. And so I would say that the parents should listen to teachers. They usually are a pretty good measuring stick.
Is this, you think, maybe an alternative to medication? A lot of parents nowadays, they simply don't want to give that medication because it changes the child's personality so much.
Well, you know, listen, again, we're learning centers. We're not healthcare facilities, so we don't really comment on medication. But as you know, the program, we don't use medication, not because we think there's anything wrong with it per se. It's obviously a useful tool that can be helpful, but it doesn't actually address the problem. It only is a Band-Aid.
Have you seen children maybe not have to use their medication as much after going through the program?
80% of the children that come into our program are actually on medication. But 80% of those children, the doctors have taken them off of medication by the time they come out of the program. And we had one major study that looked at our program last year that was published in a medical journal that essentially showed that 82% of children with ADHD that went through our program, that within 12 weeks no longer met the criteria for ADHD.
Wow, that offers a lot of hope for a lot of people out there right now. You will be at Brain Balance tonight, won't you?
I will be there today. We have, and it's in Herndon, you see the address. We actually have a grand opening, so anybody that wants to come by.
So today is the grand opening.
Today is from 2 o'clock, from 12 o'clock to around 2. And then tonight I'm doing a lecture at the Clovis Memorial, Veterans Memorial Building. It's across from Clark Intermediate School. And it's from 6 to 8 p.m. I'll be doing a parent and teacher lecture. So anybody that really wants to come down and really hear what we're doing. And obviously I'll be meeting people and signing books and love to be able to talk to anybody that has any questions about that.
Well, I'm sure they would love to hear more from you. And if you'd like to get the books, it's Disconnected Kids and Reconnected Kids. Where can people find your books?
Amazon. We just did a great book signing at Barnes & Noble last night. So they can go to Barnes & Noble. They have plenty of them there that I actually signed for them. And they can go on Amazon. That's probably the easiest way to get it. And you know, it's available at all the major bookstores. Well,
thank you for offering hope for a lot of parents out there. If you want to get hold of anyone over at the Brain Balance or need more information, all you have to do is call the number 324-0200, or you can also go to brainbalancecenters.com. I believe it's brainbalancecenters.com. It's right on your screen there. Doctor, it was so good talking to you. Thank you for being here, and thank you for, as I said, offering hope.
That's my pleasure.
All
Thank you.
right, nice to meet you. So to come here on Central Valley today, how you can help put a stop to domestic violence, a sit down with Tulare County District Attorney, and why he is hitting the pavement. We'll be right back.